All right, here we are. Team World Changers, team meeting. Arlene.
So we're meeting with
Ketan Patel.
and we'd like to introduce ourselves to him. So, should I go first?
Yes.
So, okay, sorry. So, I'm Arlene Martinez, and actually, one of my biggest goals in life is to open my own nonprofit organization. So that's my ultimate goal. And currently, I'm in my master's program for marriage and family therapy. And after my MFT, I plan to continue for my PsyD. And then with that, build a community of therapists that can do work for children and adolescents. And obviously I want to do it in Los Angeles, but that's one of my biggest dreams is to end up in Costa Rica. So that's why when she mentioned, that you had a project pending for Costa Rica, we're like, oh my God, how cool. But that's me.
Okay.
My name is Melissa. I work as a freelance producer, so I work in producing television shows, but I have a passion for film, for filmmaking, and I also am doing a master's in education, which most people think that's two different careers completely, but my goal is to combine both of them. Because in the society we live in today, we utilize the internet a lot, we use social media, people can send messages through film, through television, through short videos, and so why not combine education and teaching people through film rather than drowning them with books and papers, so hopefully they'll be able to do that.
You will.
Hey, my name is Monique. Growing up, I had a very difficult time with English, so I actually pursued my English degree, and I received my master's in comparative literature this past May.
Woo.
And basically, my ultimate goal is to go into the law field. I'm working as a translator right now for a contracting agency, and they work for a governmental agency. So I don't know exactly where I'm going headed yet. So somewhere in that field.
Do you love traveling?
I love traveling.
We all do.
do.
We all love traveling.
I think we're being in the wrong place.
I know, right? We should be like in some other country.
I'm Lindsay. As you know, I have a background in marketing and doing nonprofit fundraising and helping with such campaigns as the 2010 Classy Awards, reaching out to all kinds of nonprofits, businesses, and helping them with their marketing and their social media marketing for their Classy Award campaign. From there, my company LMH Promotions has been taking on all kinds of side projects and doing all kinds of marketing for companies like Guess Clothing, to San Diego Audubon Society, to most recently Peruvian Hearts, which was an orphanage in Peru that I spent the holidays with and did some pretty awesome fundraising for them and spent some great time down in South America and Costa Rica. So when you mentioned Costa Rica, of course I thought of my friends in Costa Rica who are awesome and cut from the same cloth. So we're happy to have you here. So please tell us about
Yes,
your
please introduce
mission in
yourself.
life.
Oh, wow. Well, you guys are impressive. I mean, that is... You guys, I'm just a random guy that's showing zebra cakes and you let me in.
Yay!
We're second for
He's the winner.
And Capricorn, right?
Oh, Capri Sun too?
Yeah,
Oh, man.
I was putting it
Busted
Can't
out.
go wrong with that.
Oh, you can't.
My background, I graduated as a biomedical engineer, and I thought, that's impressive, but there's nothing that I wanted more than to start my own nonprofit organization. My biggest goal in life was to build clinics and medical camps, so I wanted to go to medical school for the longest time. And when I realized that I didn't really have to go to medical school to build medical camps and clinics, it was a win-win situation. I have a twin brother and my twin brother and I started Dr. Interns a few years back, known as Global Aid, and our mission was to take college students, that had no idea what they wanted to do with their life, but they knew they wanted to make a difference. We had an application process, and our first year we had 150 applications to making a difference in India. When we went there, we realized that there's huge demand of needs for not just students, but medical professionals. So we decided, let's start a grant, let's start a fellowship program in India for everyone else that's going to be coming year after year after year. So we started that and we grew it out to being where we're at now, where we go to different locations, and like you guys, we want to make a difference and we don't know exactly how. And that's okay, because I think what makes our organization great is we keep bringing in new interns, we keep bringing in new leadership. Like I said, it's myself, but it's grown to being more than just me. And the great thing about that is as you guys said, you have these great ideas of going abroad and starting your nonprofit and working with all these different agencies here to making a difference. I think that's what's great, is you can have an idea and partner with people that are traveling abroad and partner with them and then make your lifetime goal come
And have an amazing time.
Yeah, my big thing, my dad actually is a huge person that was an advocate of children's education. And I think what that's ingrained into me is the most vulnerable population is children and women. And I think if you're able to consistently give back to those communities, building medical camps or clinics, you're actually building a great foundation in these areas. And I think that's our goal, not religion, not anything else. I think if I help one person, they're going to go out and say, I want to help another person.
Right.
And that's what we realized. This internship program started off with 5 people.
I was
And
just
now,
asking, how many?
yeah, now we get about 750 applications per location. We were at one point doing Ecuador, India, Costa Rica, Thailand, South Africa. We're doing multiple places. But now we're zoning back and saying, okay, how can we make the biggest impact in this one community? And how can we continue to do it year after year after year? And that's the same concept, let's take one group of people that are saying, hey, this is so great, this is awesome, I want to do this and I want to build it in Costa Rica. And you take that mindset that was in India and you bring it to a different country. So it's kind of what you guys are doing. You guys have gone there and you've seen what you've seen and now you want to make something out of it. So imagine that times it by 5 different groups of people, but with the same mentality. That's how we've
Larger
continued.
impact.
Yeah, that's how we've continued.
And so you've been recruiting medical interns, but obviously there's other needs as well. So have you been recruiting people with other skills, or?
That's a great question. As I was saying to you earlier, I think it was a great idea when we first started it. I think the concept was pre-medical students that want to, do the medical aspect. And the reason why we're successful now in branching out in all these different avenues is because it's not just me. It's not just my brainchild. It's bringing people that have, public health backgrounds, that are thinking about the more long-term sustainability process, bringing in engineers to figure out, how are we building these clinics? How can we make it so that we're not paying for electricity, for example? Solar panels in India would cut down our costs for years and years to come. Yeah, it's a heavy investment, but it's good. It's a good idea. Bringing in finance people that can actually think about, let's build out an actual business plan, not let's just throw money at the problem, which I think a lot of nonprofits are doing. It's a great thing, if you are capable of getting grants, capable of getting a large number of interns to come, you can make a lot of money. But if you aren't able to do the long-term sustainability, what was the point?
Sustainability.
Sustainability, check. Yeah, and I think that's what we're trying to do now, is trying to branch out to cover.
Not just show up, build a hospital, and walk away.
Just walk away. I mean, it's easy.
Here's some equipment, here's some training.
Yeah.
Best of luck.
Have fun. There's a lot of organizations now that are out there that are helping developing countries, work medical devices. Because it's cool. You got this new $2 million equipment, but everything's written in English. What's the point? So it's realizing.
And what happens if that one person that learned how to use it gets sick or moves away?
Well, what's happening now in these areas is you train someone, and then what's going to happen is, okay, you're living in this remote area, and then in another 2 years you get another job opportunity living in the city, twice as much pay, and why aren't you going to leave? And I think a lot of that is what our goal is to find physicians that are thinking the same way that we're thinking. We're thinking, let's give back, let's help, and let's stay for the long term.
Cheers!
Cheers! Woo!